further ado, I'm going to introduce Jules Harrison, who is our EDI consultant for East Midlands, and he's going to present on the equality impact assessment. It's over to you, Jules. Thank you.
Beautiful, beautiful. Thank you so much, Marion. As Marion said, my name is Julian Harrison, or Jules as I prefer, and I am very good fortune to be the Equality and Diversity and Inclusion consultant that is used by the Centre for Ethnic Health Research. Just a little bit about me before I go into the presentation. I've worked in equality and diversity and inclusion and community cohesion for about 20 plus years now, doing lots of different things, including working in local government as well as in the sort of health sector. I also do, the other sort of side of me is that I do lots of lived experience work. I have a lifetime lived experience of mental illness and of autism. And so I do have quite a lot of experience of some of the PPI work, lived experience work, that we'll also be focusing on today. I probably should just say at the outset that I'm not too well at the moment, so I hope you find what I have to say engaging and thought-provoking in equal measure. So that's the aim anyway. So then, we're doing on quality impact assessments. I guess we need to ensure that people know what it is we're talking about. So what is an equality impact assessment? Well, essentially, it's similar to a risk assessment, but one that's focused entirely on equality. And an EqIA, Equality Impact Assessment, is a process that involves analysis and practical implementation that helps a range of things. Could be a service, could be a policy, could be research, could be a review, could be a project, to ensure that different people's needs will be and are being met. And obviously in this presentation, because of the context of what we're doing it, we are focusing solely on research. An EqIA ensures that consideration is given to issues of fairness and of acting flexibly and differentially to ensure equal opportunity. It pays particular attention to the legal obligations outlined in the Equality Act 2010. That's where the basis of lots of equality impact assessment work began, was when that act came into fruition. An EqIA, we believe, is an essential part of the process of planning work. It prompts you to think more widely and more deeply. So it's not just about the simple completion of a form. It might start with a form, but it certainly doesn't end there. It's a live process that should last the entire length of your particular research study. So it may change, it will change as a consequence of what you do. An EqIA needs to be undertaken by someone with a good understanding of the research area. From my experience, lots of people believe that equality impact assessment should be done by equality and diversity staff. Well, there's an argument for that, but the counter argument is you actually need somebody that knows very thoroughly the research background and what it is that your study is pretending to do. So that's why it needs to focus on study teams and contacts accordingly. So why do an equality impact assessment? Well, hopefully this diagram highlights the main reasons why doing an equality impact assessment is a positive and necessary process to help you make your research or project be more inclusive and therefore more effective and relevant to people on the ground. So I'm just going to look at each one of these very briefly in turn. The mandatory case. Well, completing an equality impact assessment form prior to the beginning of your research may be a mandatory requirement of your organisation or become one in the future. In East Midlands, it is a mandatory requirement. So every bit of research that is approved and is funded by East Midlands has as a requirement right at the onset that an equality impact assessment is done. But it's not, as I said before, it's not just about doing a form. Committing to and undertaking the process through the entirety of your research or project may also be a mandatory requirement. And this ensures that your EqIA is continually being checked and, if necessary, amended. I think it's worth saying actually that there are increasing demands from key organisations and funders in research for equality analysis to be an integral part of any funding bid. So it might well be, if it's not already, a mandatory requirement for you to show some equality thought, to show some equality impact right from the outset. And this is why it's right and important to get it right and to think right from the start about equality. This may seem to be the real crux of the matter, the moral and ethical case. Well, doing an equality analysis, an equality impact assessment, focusing on equality, ensuring fairness is essentially the right thing to do, we would suggest. It's the same is true of treating people differently in order to ensure that fairness is an integral consideration. Learning more about different people is an essential component of a fairer, more socially just society. It just is, yeah. So social inclusion can be focused on and potentially increased. So all of those reasons give a quite succinct but powerful sounding that for the moral reason, for fairness, for equity, it's the right thing to do to focus on equality impact. Of course, there is a legal case I mentioned before. And just to remind you, I'm sure most of you, if not all of you, are familiar with the Equality Act 2010 and what it says with regard to due regard of the need to do three things, three aims of the general duty, which are to eliminate discrimination, harassment and victimisation, to advance equality of opportunity between people who share the protected characteristic and those who do not, and to foster good relations between different people when carrying out their activities. A thorough EqIA should therefore ensure that these legal duties, and indeed those enshrined under the public sector equality duty, are both understood and met. Lots of you, if not most of you, will be working for public sector bodies. Public sector bodies have a public sector equality duty. The universities of Leicester, Nottingham, for which the Centre of Ethnic Health Research is a part, have to do equality soundings. They have to meet these three general duties. Putting an EqIA in the way of research, though, is relatively new, and that's what we're going to focus on today. Maybe just worth, just before I move on, just talking a little bit about what this word due regard means, just so that you're familiar. Basically, the duty to have due regard means to equality considerations means that whenever significant decisions are being made or policies implemented or developed, thought must be given to the equality implications. And the significance of those implications and the amount of thought that needs to be devoted to them will vary depending on the nature of the decision and who is being considered. If you translate that into the research context, you can see it's quite apparent. It has to be part of any research, fundamentally as part of any research, to focus on equality implications. There is an organisational case as well. We would suggest that effective EqIAs help an organisation not only meet its legal duties, but to become more accountable, more inclusive, more credible, and more community orientated. Community confidence in an organisation is likely to be increased, which got to be a positive thing. As a consequence, the organisation in question becomes more trusted and becomes an attractive proposition to both prospective employees and to bodies wishing to engage with it. It sends out positive signals. It helps to develop a good reputation. It enhances value for money. It informs business plans and aids transparency. And therefore, it could be said that equality impact is good for business. The community case. Effective EqIAs ensure that community needs are thought of from the outset and are met throughout the process. A good equality impact assessment notes and addresses the fact that different people may require different approaches. Underlying this is an understanding that communities are not homogeneous groupings. One size certainly does not fit all. There is a need for flexibility in your engagement processes, in your promotion of work, in your information, communication processes, and so on and so forth. You will need to be flexible. You will need to adapt to people in their different needs. This is what good equality impact is about. It's showing, enabling you to think, how do I do this? How do I reach this community? How do I involve these people? How does this particular issue be flavoured and is seen by different people from different communities? There is greater attention to detail, therefore, if an equality impact assessment is conducted in a thorough and professional manner. And this is an important consideration for people in communities. They're more likely, we would suggest, to engage with the process, knowing that their issues have been duly and properly reflected and considered, that they have a voice around the table and that their voice is listened to. Specifically on research, though, an equality impact assessment I think should be part of the background work that you undertake to formulate your research proposal. This is not an added extra. It may be seen by some people to be an added extra. It's another thing to do, but actually what you're doing here is integral to the thoroughness, to the quality of your research proposal right from the very start. An EqIA is therefore needed to enhance research. Our work with different researchers and professors in university across the UK shows actually that most research has been completed on people that are not representative of the population and patients being treated and or receiving health and social care. If you think about it, how could you do research on prostate cancer, for example, without the involvement of people from Black, African and Caribbean communities? Men from those communities are twice as likely than white people to get prostate cancer. That is surely self-evident that it's an important thing to involve those people for whom these health needs are particularly critical. A thorough equality impact assessment is therefore more likely to ensure that your research makes a real difference on the ground. And lastly, from a research perspective, particularly for those of you that are developing maybe at the start of your research journey, doing PhDs and so on and so forth, completing an equality impact assessment is important for your professional development. Installing equality and diversity principles, practical tips and so forth is going to ensure that your research does what it's set out to do. So in summary, completing an EqIA form prior to beginning your project or research study may be a mandatory requirement of your organisation or become one in the future, or of course, in the case of ARC East Midlands, it is already a mandatory requirement. Ensuring fairness is the right thing to do. A thorough EqIA should therefore ensure that the legal duties under the Equality Act 2010 and those enshrined under the Public Sector Equality Duty are both understood and are met. EqIAs help an organisation not only to meet its legal duties, but to become more accountable, more inclusive, more credible, and more community orientated. Effective EqIAs ensure that community needs are thought of from the outset and are met throughout the process. A thorough EqIA is therefore more likely to ensure that your research makes a real difference on the ground. When I was reflecting on these this morning, this might be a side of how my mind works, but 2 TV adverts came immediately into the back of my head. Firstly, the old Heineken advert. It reaches people other research might not reach, if you translated that into the research category. And also the Ronseal advert does what it says on the tin. Actually, an equality impact assessment does what it says. It's quite simply an assessment of equality impact. Just want to talk a little bit about how this actually works in ARC East Midlands. Effectively, what you're seeing on the screen here is a summation, if you like, of the equality impact assessment process. It starts right at the outset when people are doing their funding application, putting in their funding application to the scientific committee of the ARC East Midlands. There are 2 equality impact assessment questions on that main form. So it gets you to start thinking about equality right from the very start. Once the study is funded and it's supported and is given the green light by the scientific committee, study team contacts are invited to join either a workshop or a briefing session arranged by us, the Centre for Ethnic Health Research, to offer and provide instruction and further clarification. So before you even start doing your equality impact assessment form, there's an opportunity for you to meet us, to talk through things, to talk through ideas, to let us know what's in your mind, and for you to find out what's in ours. We then send out a package of information, which I'll come on to in the next slide, and that's sent to the study team and contact prior to that particular session. So you get a view of things, what it is, not just the form, but guidance notes and so forth. Study team then completes and submits a form, which is then considered and reviewed by our EqIA panel, which you will meet shortly. The panel therefore gives detailed feedback on the form. It's then sent to the study team contact and is digested. And if there's any feedback that needs clarifying or solidifying, further communication happens between our panel and the study team. As the research study starts, progress reports on the study include updates on the equality impact assessment. It's a mandatory part of every progress report. And lastly, hopefully for comfort and a bit of solidarity and a bit of a way of easing some tensions and about easing some nerves, our panel is available for ongoing advice and guidance right the way through your research journey. I mentioned the toolkit. Well, this is what the toolkit involves. Yes, there's a form and there's a neat action plan ready for you to fill in. We include with the form some guidance notes. There's about 11 pages of this. It goes through every question, and I'll come to the 7 questions that are asked shortly. It goes through every single question in quite meticulous detail, giving you hopefully all you will need to be able to answer the questions on the form. Accompanying those key things, we have a directory of organisations and website information, and that is a substantial piece of work. There's now about 1,000 entries in this directory. And it also includes now up-to-date information from the census 2021. So there's lots and lots of work. There's lots of work have gone into it. It talks about or includes key organisations that you might want to consult, organisations that reflect particular communities. It goes through the Equality Act considerations. It includes up-to-date reports that you might want to cite as evidence in your equality impact assessment. We also include a health inequalities data sample, and this provides, there's about 60 pages worth of this now. It's a heck of a document now. Again, includes up-to-date information from the last census, and that's information really for you to sort of think about in terms of maybe including some of it in your equality impact assessment process, but it takes you into the level of detail that may be required, of course, depending on what your research is about. And lastly, we have a sample template. It's an example based on mental health, and this gives you some idea of what a good equality impact assessment form and process should actually look like. It's a hefty document, but hopefully it will make a lot of sense to you when you look at it and you realize actually this is what we need to do. This is the level of detail we need to go in. These are the areas that we need to cover. All this is available on the website, the East Midlands website. Here's the website page. This is what it looks like effectively, the Equality Impact Assessment Toolkit, just to give you a little bit of indication as to what's included here. And these are the headings, I guess, that relate to each of the documents I've talked about. Again, there's the action plan on the left, the guidance notes coming in, the directory that I talked about is there, the health inequalities data sample, and of course, last but not least, the sample equality impact assessment. So these are what those documents look like. And there's a link as well to the page if you haven't looked already so far. So what do we ask on our equality impact assessment form? Well, essentially there's 7 questions. You can see them there. The first 2 are about providing descriptions of the research, looking at aims and benefits. They effectively replicate what's already on or has been answered on the main study protocol. So it may well be that, yes, they haven't changed before you do your equality impact assessment, but they're there to provide us with a bit of background reading on what it is you're trying to do, what you're trying to get out of your research. We ask you to identify any previous qualities related research or consultation relevant to your research. And there might be lots of that, there might be very little of that. Obviously, this context will determine which one of those it is. You're asked to describe how the research, study, review, or proposal will or may affect or impact upon equality. And to help you to do that, we look at each protected characteristic grouping in turn. It also asks you, in addition to the 9 protected characteristics, to consider other equality areas, might be socioeconomic status, might be carers groups, might be specific community groups, gypsies and travellers, asylum seekers and so forth. All of this will depend on your research aim and your research area. 6 is basically a summary of the main equality issues identified through the analysis. And lastly, we ask the question, how will you monitor and evaluate the equality impact of your study? And equality monitoring is essential to a good equality impact assessment process. So you'll be asked to think about that, and of course to put some stuff in the action plan to get yourself going. Having looked at all that, this is an essential question. What difference has doing an equality impact assessment made? Well, we've shown, or we've been told, that researchers widening their equality focus and appreciation, considering issues in their approach that they have not thought of before, and recognizing the importance of EqIAs in the grounding of research. This is common feedback that we get. An appreciation of the need for tailored approaches, like I said before, that one size does not fit all. We've found early evidence of changes to trial design and to planned methods of recruitment and engagement through a better understanding of inequality, of inclusion, as well as of communities, and an appreciation of intersectionality. We've found a greater and greater willingness to engage with our staff and those with knowledge of specific approaches and/or communities. As I said before, we're there to help you if you're doing an East Midlands process as you go through your research at all stages. Seeing and demonstrating that equality analysis is a process and that it will change either fundamentally or in more subtle ways as the study progresses. The action plan that you begin with will not be the action plan that you end with. Things will develop, you'll be adding things, you'll be ticking things off, you'll be going into new areas and so on and so forth. And we've seen more effective use of available and varied data and the importance of equality monitoring. Specifically, we've seen more focused consideration of issues of stigma and discrimination. These can be related to lots of things: mental health, learning disabilities, LGBTQI, plus epilepsy, all sorts of areas. So sometimes this relates to the specific research area, the specific health condition. Sometimes this relates to communities. Sometimes this relates to both and how they intertwine. We've seen the recognition of the importance of accessibility and the need for a more flexible and varied approach to disseminating information and to planning focus groups and workshops. You do need to do things differently. You need to go to where communities are in lots of cases. You may need to tailor things accordingly. You might want to think of specific sessions for women or specific sessions for young people. This is what we mean by this flexible and varied approach. We've also seen recognition of the relevance of other groups in addition to the 9 protected characteristics. Of course, those 9 protected characteristics are enshrined in law, but good equality practice means going a bit further, recognising that people are discriminated against in a health setting and in other settings for reasons in addition to or other than those 9 protected characteristics. We've seen an appreciation of the need to address, minimise negative and adverse impact and evidence of thought as to how to accomplish this. And we've seen some evidence of some coordination between different study teams with respect to matters raised in respective EqIA feedback. Comments made by people attending our sessions and getting our feedback have shown that our approach to research development has in some cases opened people's eyes to new possibilities and to seeing things in new ways. And that's very much what equality is about. I want to talk about this study. This is a study that's been supported. It's a study that's based in both London and in Yorkshire. We received this from the two study teams, both from Pippa Shaw and from Zinira Kushid. And this is what it is, the UCLP PRIMROSE study. It's a national research project evaluating the implementation of a primary care intervention to improve the cardiovascular health of people with severe mental illness. And the background to this work highlights inequality, with a significant mortality gap between those with severe mental illness and those without consistently demonstrated. The research team were already tackling their research through the lenses of intersectionality and inequality, and as mixed methods researchers, they were embracing the process of reflexivity. So specifically, I asked them, well, how has this made a difference? What would you say has made a difference to this? And they said this, that the EqIA has helped them focus on the high intersectionality between protected characteristics and their patient participant population, people with severe mental illness. This pushed them to revisit the patient-facing documents and processes around patient participation in their research. They were amending the study design and materials from previous PRIMROSE research. So they discussed various protected characteristics related to their research in their patient and public involvement, their PPI sessions, and as a result made changes based on accessibility to the research, as well as the availability of information. This also led them to expand their PPI in other ways. Although a PPI panel had supported the document of the previous research, they were keen to improve the diversity of people on their PPI group. Therefore, a further 2 PPI groups would engage to work with them, and this provided additional input from the voluntary sector and from other peer coaches. Additionally, they wanted to build into their research a way to capture barriers and facilitators to patients accessing UCLP PRIMROSE related to protected characteristics, which may also be barriers or facilitators to taking part in the research. So this included, for example, a direct question in their amended topic guides to ask those implementing and delivering the intervention during interviews. This enabled ongoing monitoring, which due to the iterative nature of their work, gave them the opportunity to address barriers with reasonable adjustments where possible. Again, it's that flexible and adaptive approach. Building an action plan as part of the EqIA also prompted them to incorporate monitoring systems to their research processes. And this was particularly useful when working with PPI. The PPI impact log is now an important part of recording what happens in PPI sessions, as well as tracking what they have actioned and why not, so that they could directly capture the impact from the PPI approach and provide feedback to groups and stakeholders. They've also built in thinking about equality, about protected characteristics, and impact on participant engagement into the reflective practice of the research fellows. Their reflexivity is also a source of qualitative data in the research and will contribute to research outputs. Finally, project updates and outcome dissemination will also be created and assessed during best practice for accessibility and guidelines for health literacy. There's still a considerable amount of research at the end provides a report or an academic paper. There's nothing wrong with those. They're equally valuable. They're equally necessary. But often more patient-focused, more public-focused outlays that talks about what the research has done can be overlooked. The use of plain English, the use of easy read, and so on and so forth. That just helps communities also understand how their input has helped shape the research and what has happened as a result. I'm going to pass over. Have we got Patrick on the call? Just let's think. Is Patrick there?
Yeah, I'm here.
He's here. Bless him. Patrick, just he'll introduce himself. He's a research associate as part of East Midlands, that he's just provided some thoughts on what it's meant to be. So Patrick, do you want to just take over just briefly?
Yeah, thanks, Jules. Yeah, so I'm Patrick Hyton. I'm a research associate within the East Midlands team, and I kind of lead on or work on a number of different projects in the kind of ARC package, I suppose, at the moment. And I've done a couple of these, or I suppose done is the wrong word. I'm doing a couple of these kind of ongoing EqIA processes for these studies. So would you just mind next slide, Jules? I've only got the one slide. And so I suppose my job here is to give the reflections on what the process is like as the kind of end user, rather than, you know, the team that developed the package, the EqIA kind of system. And I mean, Jules has already said this, but just to reiterate from my perspective, is that it really does do what it is designed to do. And for me, it was a very kind of supportive process to think about the EDI principles and impact of the work that I, you know, was planning, or the different projects that have been planned. And I think in particular, when you are developing a kind of a grant application or a funding proposal, or whatever the first stages are of a research project, there are a lot of pressures on you as a researcher, time-wise and otherwise, and you know, things that need doing. And I think the most important thing to say is that when I have done these in the past, they have not felt like a hindrance or an extra thing to think about and have to stress about in addition to everything else. It's been very much a supportive process, and it for me it prompted me to take a step back from the kind of minutiae of the you know, methodology or the details or whatever it is that you've probably been in the weeds with for weeks about thinking about your application, and have a look at the wider implications of what you're trying to do, and more importantly, how those implications could differ depending on the population that you're engaging with or not engaging with. And that kind of strengthens both how the research is done in terms of, you know, simple things like thinking about recruitment strategies, thinking about what groups to involve in these stages, and where you need to go to kind of get the people that you're most interested in working with. So it kind of helps on a very much a kind of practical level, but more so on a wider impact level, in that ultimately you want to be able to run the study that you want to run. You want to do it in the people that you want to do it in, and make sure it runs the way it should. But you also want to make sure that the results you have after your study are impactful and meaningful. And, you know, Jules's example was perfect in that if you run a study regarding prostate cancer and you only, you know, have recruited white people, that might give you some information, but how useful is that when we talk about the wider context of kind of healthcare in the diverse UK population? So I think for me, it's been helpful, like I said, both from a practical perspective, but also a more kind of overarching view of the research. The studies are ongoing. And I suppose it's important to say also that I've done this, or I'm doing this, for both a kind of primary research study and a trial, and also a systematic review study that is kind of heavily informed by PPIE work. So although intrinsically you would think that this process is more suited towards primary research, it can be applied really to secondary research as well, because ultimately you're still answering questions that are relevant to health. And that's been really interesting to do that on a systematic review, where you could very easily shut yourself away in a room and do it by yourself for 6 months and come out with a finding that may or may not be useful. And lastly, I suppose the process has been, I suppose I've alluded to this already, it's been very supportive, I've found, rather than a prescriptive, you must do this, you must do that. You know, the panel and the team that help you do this are there to help you. It's not a funding panel. It's not a yes or no. You know, they're there to improve the quality of the research. And it has felt, although the term mandatory has been, you know, thrown around a lot, it hasn't felt like it's been mandatory. And in fact, I've been kind of pushing or inquiring about being able to do this on more studies that are externally funded that I'm pursuing. So it's something that I'm keen on doing more than just in the areas that I'm, you know, mandated to do so. So anyway, that was just a very quick reflections on the process. And yeah, the conclusion is I found it very helpful. and it's broadened my thinking about how research is done and what it means to you know, what research findings actually mean. Cheers, Jules. That was it for me.
Thank you so much, Patrick. I hope that's having the perspective of somebody actually doing these and involved in research, I think is what's needed, and we're really grateful for you to give your comments. So thank you for that. I'm just aware, I am aware of time that we need to sort of push on a little bit, because we've got Christine Smith going to talk to us a little bit towards the end of the presentation on her reflections. But I just wanted to update on a few things. Patrick alluded to a couple of them actually. Currently within East Midlands, we've looked, according to my records, at 29 studies, including 4 systematic reviews. We've begun to see links between pieces of research. Sometimes it's the same researcher, of course, so there's bound to be a link. But often, as Patrick again alluded to, people are starting to say, well, actually, this came up in our research. Has it come up in yours? It's that cross comparison that I think is really useful with that. We encourage people to do almost like mini EqIAs. So within the course of your research, you might want to do a sort of equality impact assessment approach, a specific approach to recruiting people, to putting on a focused groups, to having a meeting in a particular place, to designing some literature that promotes your research. All of this is informed and can be informed by equality impact assessment, and it can be really, really useful. Systematic reviews, we've developed a specific form and guidance notes for systematic reviews, recognising that there is, of course, some difference between those and primary research. We have a monthly, we call them interactive seminars. They're essentially our panel, Barbara, myself and Sandra Paget, and every month, people come on from all over the place, want to talk about, want to raise some questions, want to pose some issues, want to get some feedback on equality impact assessments, and we're there, and that's on offer every month for you to do that, for you to book on if you wanted to do. We're doing some specific work on funding applications, as Patrick was saying, that specific work being actually for funding applications outside the East Midlands process. What do you need to see in terms of equality impact in that? We're doing some work on the Community Voices panel, which I suspect Christine might talk about, so I'll leave it at that. And I think we're influencing the wider use of equality impact process, and again, that's something Christine will talk about very, very shortly. We have some challenges, of course we do. You know, just we have a system in place. It doesn't mean that the work is all done. There's a constant effort of fine-tuning. We need to develop the process as we go along, in that sort of sense. So some of the challenges, well, yes, ensuring that people do live action plans, that your action plan varies and changes as you go through. That is a challenge for researchers. It's a challenge for us as well. Getting leadership, getting people to own the process and promote the process is an ongoing piece of work. It's an ongoing challenge. Ensuring that there are tangible outcomes, of course, that goes into saying. And lastly, intersectionality. Intersectionality is one of those things that when you read about it, when you think about it, when you study it initially, you think, oh, that's very obvious. People have multiple identities. It's not so easy to analyse whether we're looking about research or whether you're talking about service delivery. So we're doing a lot of work there in terms of how does a good intersectional approach work in terms of all these things. And that's what we're about. We're trying to get change mindsets. We're trying to incorporate an equality dimension to research thought and to research action. Trying to get people, again, as Patrick succinctly said, to think about equality all the way through their process so that it permeates everything that they do. Okay, just to finish this presentation, I'm just going to pass over to my good friend and colleague, Christine Smith, who is a fantastic friend and colleague, despite the fact that she's a Lancastrian and I'm from Yorkshire. I don't hold it against her.
I do.
Not all the time, actually. I do. But over to Christine, just to give some reflective thoughts as we finish this presentation.
Thank you very much, strange Yorkshire person. I wasn't going to talk about the Community Voices panel. However,
okay.
Very quickly, the Community Voices panel is the strategic public involvement panel that works with East Midlands. And as part of the sort of midterm review of the ARC, sort of last year, it was recognised that and it was recognised before then, but it was formally recognised that the Community Voices panel wasn't and isn't as diverse as it could be. So we have decided, and we have started to do an equalities impact assessment on that strategic group, which is really interesting. And it's thrown up lots of questions about, but this isn't about a specific subject, this is about everything. So therefore it's about everybody. So how on earth are we going to manage that numbers wise? How are we going to get anything like a representative number of voices? And isn't that even relevant? Is that needed? Is that some really interesting discussions? So we're not finished on that, but maybe in seminar 3 we will be finished by then, and I could maybe feed back at what we've managed to achieve at that point. So what, as well as working with ARC East Midlands, I am also the public involvement lead for ARC Yorkshire and Humber. And in conversation with Donna, the program manager, assistant director for the ARC in East Midlands, we had a conversation about, I wonder what would it look like to try and use the toolkit not in the East Midlands, in a completely different system that works very differently. So that's what we set off to try and do. Last year, I was asked by the ARC executive group to come up with an EDI proposal. They came to the PPI person to do the EDI proposal, which was interesting all by itself. And that's a pattern that is repeated across many of the ARCs and many other programs as well. So what I did was I came up with an EDI proposal, and as part of that EDI proposal, there is a pilot equalities impact assessment of a project. So the point of all of this work that we are currently doing is to generate a proposal for the next round of ARC in terms of EDI and what we might do. So the project is it's about reducing avoidable transfers from care homes to hospitals. So it's an implementation project with a focus on patient safety. So it's very different from a public health or a clinical diagnosis type piece of work. So what we've done so far is I met with Emily, the project lead. She's an early careers researcher, and we had an initial discussion very early in the project. I think she was 3 weeks in, and I shared the toolkit, and a month or so later she came back with an action plan. We've set up a small EqIA team, which is myself and a couple of other very experienced public contributors, and over the last 9 months we've had 4 or 5 conversations. It's been a very researcher-led process. We didn't want to put a process in place that was very rigid. We just wanted to kind of see what was going to happen. So it's been very loose. And then last month we sat down with Emily and we had a very reflective conversation about how's it worked for you. Can we have the next slide, please, Jules? So what worked well? The toolkit worked well is the short answer to that. Emily loved the worked examples, and she found it incredibly helpful in helping her, as Patrick said, actually, in helping her think through the implications of the decisions that she was making. The flexibility of the process very much was a positive. And she's got this quote about the impact that it's had on her, which is, we're getting a bit better, I think, at say the demographics that you hear about more often. But this project has really made us think about the ones that I've never even thought about. Like, I don't think I've ever thought about how my research would impact on the LGBT community ever. And it's been really interesting and I've really enjoyed it. So she's found it, in terms of impacts on her as a researcher, they've been huge, absolutely huge. Next slide, Jules. So what needs a bit more thought from our end? What we've realised is that an EqIA can be quite paralysing for an early careers researcher. She was doing it alone because the other staff hadn't been brought on board. So it's exactly what Jules was saying earlier on. It has to be done as a team, ideally, I think. And we wondered, you know, if in any process that we put in place, could we talk about engaging the supervisors, engaging managers, because they want a very pragmatic process, but Emily, as the researcher, wants to get it right. So it's a balancing act. My original idea for this was that the earlier the better to do the impact assessment, the earlier you start that thinking. But what we found in this pilot is that if you start it too early, you get paralysed. There's just too many toys in the toy shop. So what we've started to think now is that the earlier the better, but you need at least a draft research question before you start to do this. You might not need a full protocol, although the more detail that you've thought through, the better. But yeah, so that's kind of where we're up to with that, thinking about that. And from a management point of view, it's become very obvious that any kind of EIA process is going to need really strong support and leadership from the senior leadership team in whatever organisation you're in. Because if you don't have that, and if your EIA isn't embedded in other processes like your normal reporting processes, then you're running the risk of it being siloed and tokenistic, and that's no use to anybody. She struggled a bit because this is a patient safety project and not a public health or condition specific project. She struggled a bit because there's very little data about the impact of patient safety interventions on protected characteristics. So she struggled to know what was relevant in the toolkit and what wasn't relevant. Having said that, the group that she's working with is now trying to collate the information as they go along about impacts on protected characteristics. The other complication, of course, is because it's an implementation project, is it's not just the patients they're thinking about staff members as well, because they are often participants or contributing to the study. So it's quite complex. Next slide. So the plan is to finish the pilot and the other auditing stuff that we're doing, and then to produce a report back to the executive with some recommendations, which will include some sort of recommended process, but also recommendations for capacity building. Emily suggested that she said she really wished that she'd known this when she was a graduate student, because the research that she did had nothing in it about equality at all. And she thinks that if training for postgraduate students would be really, really good, but also awareness raising at all levels from, you know, the directors downwards. And personally, I want to do a bit more thinking about the overlap, where the touch points are between EDI, equality impact assessments, and PPI. And then I've got one last quote from Emily. So she said, on reflection, it's made me really think about ways that research that doesn't initially seem to have an equality element to it, like how big of an impact an EqIA actually could have. And not only has it made me think about it for this project, it's made me think about it for all the projects that I've been engaged in, and how differently things would have been had I done this. And I think that's a really strong statement of how her perspective has changed. And it's been an absolute pleasure doing this piece of work. It's been brilliant. And it's not over yet.
Fantastic, Christine. Thank you so much for that. It's a perfect ending, I think, to the presentation as well. So thank you. And over to you, Marion.
Thank you everybody that's taken part in that. Jules, a particular big thank you to you for what are very compelling arguments and support for conducting equality impact assessments, multiple reasons why we should be doing them, and indeed embarrassing that we haven't been doing them up until now. Just to flag up again, the toolkit is there for people to download from the East Midlands website. We do have these drop-in sessions that Jules talks about, and people are welcome to drop into those and speak to our quality impact team. And thank you to Patrick and to Christine for your reflections and also for your experiences of using the toolkit. And I think that's what brings it alive, are these real experiences that you have, but obviously having a big impact on all the research that's ongoing. So we're going to switch.
Michelle, I believe that's fine then. So I think it's been a great discussion today. It's been really great to see how many people have joined us and have expressed an interest in conducting a quality impact assessment. So I think from our perspective, I think if I can just sum up the things that I think we can do as an ARC, the things that you can do, and then just give everybody the opportunity to jump in with anything else that they think we've missed that would be helpful, that is within our gift as ARC East Midlands. So I think the main thing is everybody agrees that there's a lack of infrastructure to conduct and carry out equality impact assessments, and NHR needs to be made aware of that. And Marion, I think that's something that we could probably formally do from our EDI group and following on from this meeting. So we can certainly push that forward on behalf of everybody. I think the other thing we can do is, as we've said, promote our toolkit and make it a lot more punchy and easier to articulate amongst research teams, chief investigators. And again, that's probably something, I know NHR are helping us at the moment, but maybe that's something that they could help us with as well. And I liked the idea, as I said, of selling it as a risk assessment, and maybe we can work on that, Jules and Carol, as part of that, articulating why you should do this. Another thing that we've talked of outside of these meetings is holding one of these events for sponsors. So that would include R&D leads as well, and particularly universities as well, and UHL Trust. So that's something else we can do. I think what all of you could do is go and download our toolkit. We are always open to feedback on the toolkit. It's never a final thing. So and get started. I think we've taken on board that the one thing you need to do to get started. So again, that's something that we could sort out from our end, Jules, with our team. Yep. But it would be really helpful for us if you did go and download that toolkit now, and it doesn't matter how far ahead you are with your study. I know it's brilliant to get it at the beginning, but wherever you are along the lifeline of your study, it's not going to hurt to do an equality impact assessment. And I'm not getting any dissension from any members of our team on that. We do the regular monthly drop-in sessions, which you can, I think the link went around in the chat for people to book on. So again, just to reiterate from our perspective, we've not been funded to provide a service, but what we've done within our own ARC is then everything that we can, albeit with a good sized team, which we've built up from nothing, to help ensure our research is as inclusive as it can be. And we want to help roll that out within our limitations. So I think that's my take-home messages for today. I don't know if Marion, you want to add anything, or if anybody at all has got anything to add that they would like to see from us. We'll continue to do these events. As I say, we've got another event which will just be a duplicate of this because we had so many people on the reserve list. But apart from doing this event again and the drop-in workshops, if there's anything else anybody thinks would be helpful in an event like this, that's the kind of things we want ideas about, because obviously within our gift, we want to help roll out what we're doing as far as possible as we can. And we can't do that by ourselves.
Oh, yeah, you've nicely summed up everything, Donna. Christine, you wanted to say something before we finish?
I was just thinking about what Donna was saying about what, you know, what else can we do? And I was wondering, so that sorry, project, this pilot study that we're doing in Yorkshire and Humber, that team has started to think about collecting the sort of background data around patient safety. And I wondered if there might be something that we could do that would support teams to do that in different areas. Maybe I'm not sure what that would look like, but these are the sorts of things that we realized that we needed to think about, but we didn't think about them right at the beginning. Something like that ish.
Yeah, that makes sense. That makes sense.
Kind of, yeah.
Oh, it's constantly evolving, and it's
Yeah.
East Midlands is driving this forward, and something that we're very proud of at East Midlands, introducing this, and hopefully I think we will do a good job with NIHR in encouraging them to listen and to adopt and to engage with this whole area. So it just leaves it for me to thank everybody for their huge contribution today. I think the workshops worked really well. I think we've got a lot of good feedback, how we can improve things and take things forward. But I also want to say a big thank you to Jules for his wonderful presentation and exceptional knowledge that he shares with us. But also thank you to Michelle for pulling this seminar together. She does a great job and is always the unsung hero, and just want to say a huge thank you to Michelle and the organising team. So thank you to everybody. I hope you can all stretch your legs now and enjoy the rest of the afternoon. Thank you for joining us.
Bye.
Bye, everybody.
Bye just now.